Hello everyone. Today's topic is developmental disturbances of oral and paraoral structure. This topic is very vast, so we will discuss it in different parts. First, what do you mean by oral structure and what do you mean by paraoral structure? Oral structure, that is the developmental disturbance within the oral cavity, and paraoral, that means that surrounds the oral cavity. In this part, I'll discuss the developmental disturbances of jaw that include your maxilla and mandible. The first developmental disturbance in the jaw, that is agnanthia. Gnanthia means jaw. Okay? So agnanthia means there can be completely absence of the jaw or there is hypoplasia of the jaw. ठीक है, एग्नांथिया कंप्लीटली एब्सेंस हो सकता है जॉ का या फिर आपका हाइपोप्लेसिया ऑफ द जॉ. सो जॉ कैन बी मैक्सिला और मैंडिबल. ठीक है, आइदर मैक्सिला इज इन्वॉल्व्ड और मैंडिबल इज इन्वॉल्व्ड. सो एग्नांथिया इज अदरवाइज नोन एज ओटोसेफली और होलोप्रोजेनसेफली एग्नांथिया. ठीक है, एग्नांथिया दैट मेनली शोज योर autosomal recessive type of mode of inheritance. So we will discuss the disturbance one by one. First is in maxilla, then in mandible. So in maxilla, it may be one maxillary process is missing or premaxilla is missing. ठीक है, maxilla में maxillary process, the whole maxillary process can be missing, or the premaxilla or the anterior part of the maxilla is missing. ठीक है, in mandible there can be hypoplasia or absence of the mandible with abnormally positioned ear. ठीक है, so it can be completely absence of the mandible or it can be partial absence of the mandible. ठीक है, or in mandible entire mandible on one side is missing or only the condyle is missing or the entire ramus is missing, but most commonly partial absence of the mandible is seen. ठीक है, in maxilla maxillary process or premaxilla is missing, but most commonly in mandible partial absence of the mandible is common. Okay, so why it is happening? Why there is a missing of mandible or maxilla? Why there is a hypoplasia of the jawbone? Because there is a failure of migration of neural crest mesenchyme into the maxillary prominence at the 4th to 5th week of gestation. Because it is a developmental disturbance, so any disturbances in the developmental period or in the embryonic period, it will give rise to your developmental disturbance. So during the development, if there is a failure of migration of neural crest mesenchymal cells into the maxillary prominence, then it will cause your developmental disturbances in the jawbone. So agnanthia, basically its prognosis is very poor and it can be lethal. Okay. Next one is micrognanthia. Micro means small, gnanthia means jaw. So micrognanthia, that means small jaw. Either the maxilla or the mandible may be affected. Sometimes it is not due to abnormally small jaw, but it can be due to an abnormal positioning or an abnormal relation of one jaw to other or to the skull bone that produces the illusion of micrognanthia. Then coming to true micrognanthia, it may be either congenital or acquired. The etiology of the congenital type of micrognanthia is unknown or idiopathic. Sometimes it is associated with other congenital abnormality like congenital heart disease and the Pyrie-Robin syndrome. Okay. Congenital maxillary micrognathia occurs frequently due to a deficiency in the premaxillary area. Okay. If occur in premaxillary area, then patients with this deformity shows retracted middle third of the face. Then mouth breathing habit is also associated with micrognathia. Then coming to congenital mandibular micrognathia, mandible also affected in micrognathia. So in mandibular micrognathia, you see severe retruded chin. Okay, mandible will be retruded. After congenital type of micrognathia, next type is acquired type of micrognathia. It is of postnatal origin, usually results from a disturbance in the area of the TMJ, that is temporomandibular joint. Then etiology. What are the etiological factors? That is the ankylosis of the joint. Ankylosis of the joint can be due to trauma or infection of the mastoid process or infection of middle ear or infection of the joint itself. Okay, these are the clinical features and etiological factors for acquired type of micrognathia. So this is the clinical picture of mandibular micrognathia. You see severe retrusion of chin. Here this is the mandible and this is the chin region. You see severe retrusion of chin, steep mandibular angle and deficient chin button. These are the clinical picture of mandibular micrognathia. In the third category, there is macrognathia. Macro means large, gnathia means jaw. So macrognathia means large jaw. Mainly macrognathia refers to abnormally large jaws. Can be maxilla or mandible. Next, in pituitary gigantism, there is an increase in the size of both jaw, that is maxilla and mandible, is proportional to a generalized increase in the size of entire skeleton is seen in pituitary gigantism. Macrognathia associated with other conditions like Paget's disease of bone, acromegaly and Leontiasis ossea. First one is Paget's disease of bone. In this disease, there is an overgrowth of the cranium and maxilla, and sometimes or occasionally it occurs in the mandible. Second one is acromegaly. In acromegaly, there is a progressive enlargement of the mandible owing to hyperpituitarism in the adult. In adult, you see acromegaly. Then Leontiasis ossea. It is a form of fibrous dysplasia in which there is the enlargement of the maxilla. So these are the conditions which are associated with macrognathia. Next is etiology of macrognathia. First etiological factor is unknown or idiopathic. Next, mandibular prognathism is due to disparity in the size of the maxilla in relation to the mandible. In some cases, mandible is larger than normal, and excessive condylar growth can also lead to prognathism. Some factors influence mandibular prognathism like your increased height of the ramus of the mandible, increased mandibular body length, increased gonian angle, anterior positioning of the glenoid fossa, decreased maxillary length, posterior positioning of the maxilla in relation to the cranium. So these are the factors which are also associated with mandibular prognathism. Coming to treatment plan. For treatment of this macrognanthia is surgical correction. So macrognanthia is larger, that is excessive large jaw. So we have to reduce the size. So the surgical correction is required, and ostectomy or resection of a portion of the mandible to decrease its length is required in the treatment plan of macrognanthia. So these are all about developmental disturbances of the jaw that include your agnanthia, micrognanthia and macrognanthia. So all other developmental disturbances in your oral structures, I will discuss it in next upcoming videos. So thank you so much.